Pharmacists have been available and accessible to Canadians throughout this pandemic. Minister Elliott, I welcome you to the podium to make your announcement today. Thank you.
Well, thank you very much, Hitesh, for your kind introduction and for hosting us today at your pharmacy. Good morning, everyone. I want to start by extending my deep appreciation to Jeff, Shoppers Drug Mart, and Ontario's pharmacists for your dedication to protecting the health and safety of all Ontarians. Throughout the COVID-19 pandemic, you have supported key initiatives to stop the spread of the virus. From helping with COVID-19 testing to continuing to getting shots in arms, thank you for your heroic efforts. Protecting the health and well-being of all Ontarians remains our government's top priority. Thanks to the millions of Ontarians who have rolled up their sleeves and our government's cautious approach to reopening our public health and our public health and health system indicators continue to trend in the right direction. To keep Ontarians healthy this flu season and ensure our hospital capacity is available for those who need it most, our government has invested over $89 million to deliver one of the largest flu immunization programs in Ontario's history. Last year, millions of Ontarians took advantage of the free flu shot, and we saw historically low rates of flu across the entire province. Building on this success, this year we have purchased over 7.6 million doses of the flu vaccine, which is 1.4 million more doses than last year. This includes 1.8 million doses specifically for seniors. As Ontarians' flu supply is delivered in multiple shipments, and the schedule is determined by the federal government and manufacturers, the province's initial supply of the flu vaccine was used to protect long-term care homes residents and hospital patients. This month, flu shots are available for seniors, children between 6 months and 4 years old, pregnant women, and other individuals at high risk of flu complications. And beginning in November, the flu shot is available to all Ontarians in pharmacies such as Hitesh's, doctors and nurse practitioner offices, and through public health units. In November, we will continue to receive the flu vaccine in multiple shipments, so we encourage everyone to be patient and call ahead to ensure the flu shot is available at your doctor's office or at your neighborhood pharmacy. I would also like to note that the National Advisory Committee on Immunization, or NACI, has recommended that the COVID-19 vaccines may be given at the same time as the flu vaccine. So if you're getting your flu shot and still have yet to receive your first or second dose of the COVID-19 vaccine, now is definitely the time. As we head into the fall and begin gathering indoors more often with family and friends, it's even more important to get your flu shot, in addition to following public health measures to protect yourself and all of those around you. So thank you.
We'll go to the phone lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Matthew Bingley with Global News. Please go ahead.
Matthew.
Hi, sorry. Hi there. I apologize. I'm on a teleconference. I'm not aware. Is Premier Ford there?
No, he's not.
Okay. Well, in that case, I'll get you to respond to this. I'd just like to understand how you would respond to the Premier's comments yesterday on immigrants. He made a comment about them being on the dole. Many people are calling that out as being insensitive and calling for an apology, and also pointing to the fact that it increases negative stereotypes and potential harms to new Canadians, whether they be immigrants or refugees. And I'm wondering if you would support an apology.
I don't think it's necessary, because what the Premier was actually saying is that we need more immigrants in Ontario. We have lots of work. We know that when people come here, they do work hard. They provide for themselves and their families. They contribute largely to our communities, and we need more people in Ontario. That's what the Premier was indicating yesterday.
Follow up?
Yeah, we're talking shot, but of course Pfizer is of course in the news because of the doses for children. I'm just wondering how quickly would you like this rollout continue, and for the actual distribution of it, how would you like to see that handled as well?
I'm sorry, Matthew, are you speaking about for children aged 5 to 11?
Correct.
When it's available?
Yes. Well, obviously it's on to the next round here, so I'm just wondering if I could get a reaction for you on that front.
Yes, well, we are working actively with our public health units to determine a rollout for that vaccine when it is approved by Health Canada, of course. And we will be ready as soon as it's approved to be able to distribute it and have it available for children across the entire province. So we are actively working on that file now.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Laura.
Hi, Minister Elliott. I wanted to ask about virtual care and the letter that came out from Dr. Moore and others urging doctors to resume in-person visits. Is this something that the government is concerned about, that it's your impression that not enough doctors are doing in-person visits? And how do you plan to hold the medical community to account here if it's not, in your eyes, satisfactory, the amount of patients that they're actually seeing in person?
Well, no, it's not a big concern, because we know that many physicians have been in active practice seeing patients in person since the pandemic began, taking the necessary precautions, of course. One of the things that we were trying to expand when before COVID came upon us was virtual care, because we know that for certain health concerns, this is something that can be treated by a phone call, by a virtual visit between a patient and his or her physician. This is something that we wanted to expand, and it has expanded hugely, which is wonderful, and there's no turning back now. People like it. They like the convenience of it. They like the time that's saved. They get the answers that they're looking for. But for some conditions, there is no virtual remedy for that people do need to be seen personally by their physicians, and so we're encouraging physicians to do that, and they are largely doing that, so it's not a big concern at this point.
Follow up?
And just on your point there about there's no turning back, can you elaborate on the discussions that the government's having with the OMA about making virtual care permanent? How do you foresee that in the future, and what do you think the balance will be on in-person and virtual visits over the next several months and heading into the future?
Okay, well, I can't comment on specific discussions with the OMA, but I can certainly say that our information is that physicians are happy with the virtual services that they're able to provide. The public is certainly very happy with it. And so this is a way, I believe, that people can have greater access to medical services when they need them in a very timely manner. And so there is more work to be done to expand some of these virtual services across the province, so that people, first of all, can make their appointments online, they can have online visits, but they also want to be able to see their own public health records, or not public health records, personal health records, that we want to make sure that people are able to see. This is part of entering into the 21st century of medicine, and this is something that people want, practitioners want, and it's something that the government wants to move forward. So we're continuing our work on this.
Next question.
Your next question comes from Richard Southern with City News. Please go ahead.
Hi, good morning, Deputy Premier. I want to come back to those comments that Premier Ford made yesterday because a lot of people are talking about them this morning. And again, the Premier said, quote, "You come here like every other new Canadian. You work your tail off. If you think you're coming to collect the dole and sit around, not going to happen. Go somewhere else." Deputy Premier, do you agree with Mr. Ford?
What Premier Ford was saying was that we need more people to do the jobs that we have available here in Ontario. And so we encourage more immigration. We need more people in Ontario. We need more people to come from other jurisdictions. We welcome that. And we know that when people come here, they do work hard. They do work hard for themselves, for their families, for their communities. And so we welcome that. That is what the Premier intended to indicate yesterday.
Follow up?
Well, respectfully, he didn't. He indicated that they weren't working in the face of a lot of evidence to say that that's actually not the case. The opposition leaders are calling this demeaning, and they're calling for Mr. Ford to apologize. Do you think he should apologize, Deputy Premier?
As I said earlier, I don't believe it's necessary because that is not what the Premier was saying. He was indicating that his expectation is when people come here that they will work, and we know they are working. We know that people, when they come to Ontario, they work very hard to start businesses, to work in their communities. They give back. They are great to increase the economy of Ontario, increase our productivity. The Premier knows that, and I know that, and we welcome more immigration to Ontario.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Minister.
Yes.
Dr. Moore said recently that he was having some discussions with family doctors and their associations over possibly extending a vaccine mandate to them. And I wanted to get your thoughts on that. Should we be mandating vaccines for family doctors?
Do you mean for doctors themselves to have the vaccines? I'm not quite sure of your question.
For family physicians.
I think most family physicians have already had the double vaccinations, and knowing that they are seeing sometimes patients that have not been doubly vaccinated, I'm sure that doctors would want to protect themselves. That is something that I know that many organizations are recommending, and so our expectation is that family physicians would be double vaccinated.
Follow up?
Do you have any more details yet to share with us on the medical exemption process for the enhanced vaccine certificates? I know your government's guidance says that medical exemptions, the claim should ideally be referred to an allergist or an immunologist. Is that going to be part of the process when public health decides them? Is there going to be some sort of independent board made up of allergists and immunologists?
That's not something that we're looking at right now, but as you know, there are very few medical exemptions to disqualify someone from having the vaccine. And we are working with the College of Physicians and Surgeons, who have issued very strict guidelines to their members about what qualifies as a medical exemption and what does not. I understand that there have been several physicians already that are not allowed to provide medical exemptions, that they were not following the guidelines. We expect that they will. We know that the CPSO is watching that very closely, and that is something that we will continue to follow. And that, as you know, in order to have a medical exemption included in the QR code that one receives, this is something that has to be entered into our COVAX system. So there will be a process whereby people who do have medical exemption letters from their physicians will be able to register with their local public health officer, and that will be reviewed and then entered into the COVAX system, and then can be administered as part of the QR code. So we're actively working on that right now.
Last question on the phone lines, then we'll do one question from the floor.
Your next question comes from Charlie Pinkerton with iPolitics. Please go ahead.
Charlie?
Morning, Minister. I'm going to be piggybacking on my colleague Matthew's questions about vaccinating children ages 5 to 11. With Pfizer's submission to Health Canada, reasons suggest that that vaccine could be approved for this age group in weeks or even days. Dr. Moore shared a few details of the province's plans to immunize kids between 5 and 11 about 2 weeks ago, but there still seems to be lots of gaps at that time. The province wasn't aware when it would be receiving vaccines, how many it would receive, or whether it would be required to give doses first to certain populations, like those of a certain age bracket, or those who are immunocompromised. Can you fill in these details or give any more clarity about what these plans will be now that we're presumably closer to vaccinating this age group?
Sure, I can't speak to the medical aspects of it because I'm not a physician, but I can tell you about the plan. We have asked each of the 34 public health units to submit their plan for vaccinating children between ages 5 and 11, and we have received their plans. The plans are now being reviewed by our central team at the Ministry of Health, and it's a variety of ways that are going to be employed to vaccinate children depending on the different geographic location, but we will be working with pharmacies, with public health units, with primary care as well. And by the time the vaccine is approved for use by Health Canada, we will be ready to go. We have the forces on the ground ready to go, and I know that parents are concerned about this, but they need not be because we will be ready to go. We are actively working on this and putting the final plan together right now.
Follow up?
Okay, and something you said there was similar to what Dr. Moore also said a few weeks ago when he was mentioning the ways of vaccinating this age group. But what he didn't say and what you didn't say just now is the possibility of having vaccines or COVID vaccines administered in schools like other vaccines have been and are. Is this a possibility? It would seem like an efficient way to vaccinate a large group of children at once. So is that something that any of the public health units have proposed or that your government is open to have happening?
Yes, it certainly is a possibility to have something like a mass vaccine clinic at a school, not necessarily during the school hours, but perhaps on weekends or in evenings, because many parents with small children would prefer to be with their child when they receive the vaccination. So all of those issues are definitely being taken into consideration, and schools are a possibility, but subject to the ways in which I've just described for administering the vaccines.
Last question.
Madam Deputy Premier, this is a question following up from the question I asked Mr. Premier yesterday. We know of the 2 doctors that have been reported that have fallen outside of the believed guidelines and might have issued exemptions for COVID vaccinations. And you just said several doctors. How many doctors are being investigated or have been asked not to continue giving out exemptions for COVID-19 vaccinations?
I understand right now that there are 4 physicians who are unable to produce medical exemptions for any of their patients. So there were 2 several days ago, there are now another 2. So this is something that's clearly being followed up very closely by CPSO, and that gives us confidence in the system that it is working as it should be.
Okay, thank you very much for that. And the next one is about the flu shot. Given the fact that there was very few flu shots yesterday or last year because of the protocols we took for COVID, and then we usually get our flu shots from studies from Australia that usually have their flu season first.
Yes.
How do we know that this flu shot is going to be effective, and what do we base it on? What flus that we should be immunizing against?
Well, this is calculated by people that have epidemiologists and others who have knowledge of what's going on in other parts of the world. But last year's flu shot was very effective. We actually in Ontario only had 25 lab tested cases of flu in Ontario, where normally we have thousands. So it clearly did work last year, and we have ordered 1.4 million more shots this year. So we certainly encourage anyone to, when the time is available for them, if they don't fall into the sort of categories of people who are particularly vulnerable that are receiving them right now, as of early November, anyone who wants one will be able to get one, and it can happen at the same time as a COVID shot. So if you haven't had your COVID shot yet either, please come in and get both.
Thank you very much.
Thank you.
Thanks, everyone.